Someone asked for information about genital lymphedema for a female. They were willing to share the history but didn't want me to disclose the name, so let me go into detail from what I know about this person's history of why they would have lymphedema. Let me also say that treatment in the genital region is not extremely common, probably because, number one, doctors don't know that there's treatment available. Number two, patients don't know that there's treatment available. Number three, therapists may not have the training, and of those that do have the training, it's not a condition that's treated very often. So it's not something that they necessarily have a lot of experience in, and so are therefore not very comfortable treating it. And then it's also just potentially an uncomfortable discussion to have for both the patient and the therapist. It shouldn't be, because you should feel comfortable talking with your therapist about that sort of an issue. That should be the kind of an environment that a therapist creates for a patient, is one of open discussion and making that person feel comfortable that they can discuss the problems that they're having. And then that therapist can either help with that problem or make an appropriate referral. So genital lymphedema for a woman, let's talk about this person's history. Okay, so this person was diagnosed with stage 4 bladder cancer, and they had neobladder surgery in 2014. And they did have some lymph nodes removed. In 2019, the inguinal lymph nodes, so the lymph nodes in the groin, were discovered to be enlarged, that cancer had metastasized from the bladder cancer. So additional lymph nodes were removed. A couple years after that, the inguinal lymph nodes were again enlarged, and the cancer was treated with a targeted chemo, and the lymph nodes shrunk. But the legs began to swell with lymphedema. In 2022, she began manual lymph drainage massage. But all of her treatments were based in the lower legs, and the fluid has moved to the groin and the current problem, so the genital region. She said that they had 37 manual lymph drainage treatments on the legs, but the therapist didn't treat the inner thighs or anything above that point, so the genitals were not discussed. She didn't explain or show how the massage could be done at home in the private areas. These areas are extremely swollen and painful. She cannot sit, and it really limits her movement. She had 2 maintenance garments, so this person actually, she told me in a later note, did get a custom flat knit garment, which we'll talk about in a moment. But she can't wear it because she has pressure in those areas that's painful as a result of this particular compression garment. She also has a sleep suit and a Flexi Touch that she just began using. She's tried countless creams, salves, ointments, clays, sitz baths, and is now using lidocaine and Tux. She says, "We don't know where to go for help for this. They can't be the only person with lymphedema in this area, and they don't know how the swelling is handled. Is it normal to be experiencing such a high level of pain?" This person later disclosed that they were following up with the doctor because the physician felt like, or was concerned about, the cancer potentially metastasizing and causing this problem, and I could certainly understand why that would be a concern. Having the severe pain, and then there were also skin changes where there were some pimples that were beginning to develop and some open wounds. So that's certainly a concern. This person has tried a lot of things. They had tried multi-layer bandaging from the foot to the groin. They tried biker shorts in addition to that, and using a female swell spot. So there's a company called Solaris who makes swell spots, and then there's also BSN Medical who makes Jovipac. They own Jovipac now, who makes swell spots for this region. Both for men and for women, both companies do. There may be other manufacturers that do as well. Those are just the 2 that I've worked with the most. When it comes to this particular issue, I'm aware of the products that they have. All right, so the compression, she said that she was fit twice with custom flat knit pantyhose. So that's a good thing. That would be the appropriate kind of compression. And they said the first pair were a class 2. A class 2 for the right leg, the left leg, and the abdomen, but they didn't contain her. The second pair was a class 2 in the right leg, a class 3 in the left leg, and a class 1 in the abdomen, because the pantyhose were too painful in the groin area for walking and for sitting. So they tried a lesser compression class. But that multi-type of compression classes, a class 2, 3, and 1, did not contain her. And so they were asking for what could be done, and they would like to know about manual lymph drainage for this area. Okay. First of all, I am so sorry that you are dealing with this issue. Cancer itself is enough of a difficult diagnosis to handle, let alone the side effects of cancer and cancer treatment. So again, I am so sorry that you are dealing with this condition. You are definitely not alone. There are other people who have had cancer in this area and who have dealt with genital lymphedema as a result of that. So let me see if I can offer some guidance to your question about manual lymph drainage. Because this person is in a stage 4 cancer, which is metastatic cancer, the treatment approach would be palliative in nature, but it's important just to disclose that generally manual lymph drainage would be a contraindication in cases of active cancer in the area of cancer, except in the case of palliative care. So you want to make sure that you let your doctor know what you're wanting to do and make sure that they are okay with what you want to do and are in agreement.